You are listening to the Julie Parker Practice Success Podcast, where you discover management insights and strategies for your successful dental practice. There are also interviews with key people in the industry who have advice and services to help you and your team achieve great success. Welcome to this episode of the Julie Parker Practice Success Podcast. And what a joy this guest is going to be for me to talk to. I've admired him for such a long time. We've met in the past, but I've been one of those people that admires his work from afar. Dr. Mark Hassard, welcome.
Yeah, thank you very much, Julie. Pleasure to be here.
Now, your tag is the Relaxed Dentist, and you've been a dentist for a long period of time, own your own practices, but you've also done a lot of extensive study into how to have effective conversations with patients.
Yes, yeah. How I got into it, I sold my practice a number of years ago, and I was invited by one of the corporates to go around and assess their practices where they had underperforming dentists. And that was completely new to me, but I thought it was a very privileged position. So I just went into these practices and sat in the corner and watched dentists work with patients. And the interesting thing was almost always the underperforming dentists, it was because they had problems with communication. And so I thought, well, there's an opening in the market. And over the years, I'd done almost any course there was on communication. I used to actually fly to the United States to take dental communication courses. That was where the interest started. And I love talking to dentists about communication because it's something that can really change their life. I mean, I learned early on that you can be a technically magnificent dentist. Like you can just know everything. You can do magnificent root fillings, great perio, know all about implants, all that sort of stuff. But until a patient actually says yes, it's all for nothing.
Yeah, that's right. And they never get to experience that. They can't even gauge whether it's a good filling or not. So it's an unfortunate, unthankful task, isn't it? And You're right. When you come out from university, you know how to do the technical stuff. And, reading a bunch of dental books that I have over the years, you'd be the same. It always ends up being later in the career that you realise the soft skills, the relationships with both patients and team members as well, actually, but we're talking about patients here. That's the stuff that comes later on that ends up being the most impactful thing over your success.
Oh, absolutely. One of the quotes I often give to people, it comes from L.D. Pankey. He was a dentist from Florida, from Miami, and people set up an institute to teach what he was teaching in dentistry because he was such an outstanding dentist. And technically, he was absolutely magnificent. But even this guy who's technically magnificent said the key to success in practice is your ability to communicate. Yeah. He didn't say it's your ability to cut a perfect crown prep or do a great bonded filling. He said it's your ability to communicate.
And I guess that's where the unawareness, the knowledge gap ends up being, because you're a dentist, you've been doing your bits and pieces and you wanted to start either offering different services or advanced services or having a different kind of conversation with patients. You're not really quite sure where to start. And it's not just about having more eloquent questions around how's the weather today, but it's around having really meaningful conversations and being able to impart your wisdom and knowledge, all the stuff that goes on in your dentist brain, so they can appreciate why one optional treatment is going to serve them better than another.
Oh, absolutely. And I mean, people, when they come to the dentist, they're there because they've got a specific need. Now, it's our job to find out what that need is and then explain it to them, the options, in a way that they can appreciate. I mean, people aren't sitting at home going, oh, I'm a bit bored, I think I'll go to the dentist today. They're there because they want something. And quite often the dentists sort of just skate by finding out what they need, or when they do find it out, they're just so bad at explaining it. I visited a dentist a while ago. And this dentist used to do his consultations to explain treatment to patient after work at night. And I was thinking, why would you do it after work at night? And he said, because they take 45 minutes. And so anyway, I sat in on the consultation, and by the end of it, I'm sort of starting to nod off and go to sleep. And the patient was sort of all confused and bleary-eyed and everything. And in the end, the patient stood up and said, thank you very much. I'll go home and think about it. And this dentist had just burnt 45 minutes. And I thought to myself, I could have explained that in 90 seconds and got a decision. So,
Yeah.
there's a tremendous gap out there for people to learn better communication skills.
Yeah. And gosh, it's just, I think sometimes we, as a consultant, I certainly fall into that trap of saying you need to allow adequate time to have this lengthy conversation with patients. But you're saying absolutely that doesn't have to be the case, and it can actually work against you because the patient may become disengaged after 10 minutes of conversation.
Oh, absolutely. Yeah, I mean, I would never disagree with our host, but I seriously believe that you've got to communicate in as short a period of time. If you can say what you need to say in 1 minute, that's better than saying it in 90 seconds, which is better than saying it in 5 minutes. Because the thing is, everybody today, we're on our devices, we're doing this, the phone goes bing and we pick up all this. So everybody's got this little bitty attention span. So if you think you're going to sit there and have a 30-minute talk with someone about some topic, and the other thing, they're just not that interested. People, we care about it. It's our life. We've learned all about it. It's what we do. But normal people are just not that interested. I mean, one example I give you, imagine if your car broke down and you took it into the mechanic shop and the mechanic said, all you really want is the mechanic to diagnose the car, say, it's the gearbox, I need the car for 2 days, it'll cost you $1,200, right? That's what you need to know. And then you're back out the door. You say, see you later, see you in 2 days, right? Imagine if the mechanic pulled down a wall chart and said, let me explain to you how a gearbox works. You'd think they'd gone mental, right? You'd absolutely think they'd gone mental. Well, it's the same in the dental practice. We're so expert in all these little fiddly things that we do. We're dying to tell the patient about it and dying to give them technical details. And we've just got to back off entirely, give them the information they need to know and nothing more. Keep it brief and short. Now, before I pass on, there's one other thing I'd like to say about that. That's also a way of keeping practice overheads down. I mean, if you look at even a well-run practice, the cost per room per hour is about $200. Some more, some less, right? But that would be a good average figure. So if you're going to sit there and talk with a patient for 30 minutes, that's $100 you have just handed that patient.
Yeah, yeah. For them to become disengaged.
Yes, that's right.
What you've got to say.
Why not say it in 1 minute?
And so I think that's where some of the complexity lies, doesn't it, for people? Because I come from a background where I've been a patient coordinator in the past as well, and observed so many dentists deliver treatment plans over the years. Where is it providing enough information so the patient can make an informed decision about their own mouth? And where does it lie as well that a patient says to you, Mark, I've come to you for your advice. I've come to the mechanic for your advice. Tell me what I need to do.
Yeah. Well, in my view, there's a famous movie with Keanu Reeves and Lawrence Fishburne, The Matrix, right? And in one crucial scene in The Matrix, Lawrence Fishburne holds out his hands and he's got red pill, blue pill. And he says to Keanu Reeves, you pick one, and if you pick this one, this happens. And if you pick this one, this happens. And Keanu Reeves leans over and picks one of the pills, right? So I think dental presentations are like that. You say to the patient, okay, so here's option A, here's option B. Option A has these pros and cons. Option B has these pros and cons. Take your pick.
Take your pick, yeah.
Now, one thing I like about that thing about giving people options and letting them take their pick is that quite often we think we need to steer patients in a certain direction. We'll say something super smart that'll steer them in this direction or that. I've got news for you. People don't like being steered. And if they catch you steering them, that's when next thing you know, you're sending the records down the street. So, but I've never found a single patient who's ever been offended by, I was so offended. Mark showed me his option, my options. Like people are never offended by getting options, but they can be offended by, you need 6 crowns, that will offend people.
And we certainly feel that within ourselves. It's a little bit subconscious. We're a little bit unaware of it. But if we pay attention to our own response, internal response, when we are dealing with anyone that's trying to sell us something, either via an email or direct one-on-one, we can feel ourselves pull back that little bit, even when we answer the phone and it's a marketing phone call straight away, regardless of how the potential of what a great impact this product or service could be. Straight away, we're turning against it because someone's trying to tell us what to do.
Yeah. I think there's a few things I've discovered in my practicing life, and that leads on to one that I absolutely thought was amazing when I first found it, and that's what I call the pressure paradox. Now, if you push on someone, they push back, right? There's this sort of, if you push, so in your practice, like when I was first starting out in practice, I had this big mortgage and, can I pay the staff this week and all this sort of stuff. If I'd say to them, you need to have a clean, they'd go, well, I need to get a second opinion on that. So, I'm pushing, they're pushing back sort of thing. And then in the sort of at the end of my practicing career, right at the end, I reached a situation where I seriously didn't need the money anymore. I was sort of just practicing, but whether they said yes or no made no difference to me whatsoever. So I'd go, here's your options, and I'd almost be backing away. And as you're backing away and going, I really don't care, do whatever you want, they would actually come towards you.
Yeah.
And I realised this idea of saying smart things to try and manipulate people and turn them in a certain direction, it's a no-no. Like almost the less pressure, the more success. It's the paradox of pressure. You try and push them in one direction, they'll go in another. You just let them be themselves, they'll come to you.
It's really interesting, isn't it? Because we can find ourselves driven by the outcome that we want. And just the way the universe works, that pressure paradox, I think, is a bit of a universal law at place, that when you've got your hook in one area so much, you actually end up resisting it coming in, and you're putting in play a scenario, situation where you're actually pushing that opportunity away.
Yeah.
And it is recognizing that there are two people in that conversation, and the one who is going to be able to achieve a particular outcome is the one that needs to make that decision. And so, when I've talked to dentists about their treatment plan presentations and having a conversation with patients, it's kind of one of two things. And in life, we do this as well in terms of trying to avoid pain or go towards pleasure. We're either trying to the patient wants to avoid a certain repercussion of not getting treatment done or not getting the right treatment done, or their decision is around, but I want this outcome, so which one's going to lead me to that outcome?
Yeah, absolutely. Yeah, that's where I get it. Yeah, the red pill, blue pill, pros and cons. So, and one of my favourite things, people come in sometimes and they'll say something like, "This is the third time this tooth is broken," something like that. So what are they expressing? They're expressing frustration and annoyance that this keeps happening. So if you can come up with the answer, and the answer is fixing it in a way that it doesn't keep breaking, they'll jump at it. Hearing what people say is extremely important.
And so that listening aspect is so crucial in the communication. Quite often, I imagine, as a dentist, you're thinking about the next natural step in the conversation is where I educate the patient, whereas we might need to kind of pause for a little bit and just find out where that patient's frustrations are. I remember Sandy Roth. You would have come across Sandy Roth over your years, bit of a guru to me, and I love everything that comes out of her mouth. And she said, patients generally want one or some or all of the following things. They want to look better, feel better, so no pain, have greater function, or greater peace of mind. And indeed, that's what dentists deliver, all dental practices deliver all the time. And so I suppose that can help build a bit of a framework in recognising where the patient's coming from and how to have that conversation with them.
Yeah. Well, I've actually been to a seminar with Sandy Roth, but and that sounds very much, one of my gurus was a fellow called Omar Reed, who's unfortunately dead now, but he was great. And he used to say, he only had three things. People want teeth that look good, feel good, last a long time. That was his trio. And it's exactly right. If you can lead or give people those options, they'll often jump for them. Yeah.
And so, can you give us a bit of a synopsis over your career? Briefly, what led you to dentistry, and how your career and the way you approach patients, how has that evolved over your years?
Well, I was always. I think one of the things there. I can't say that I got into dentistry because of any great sort of desire, or it just seemed like a good idea at the time when I finished my HSC or BCE or whatever they call it now. But having got into it, my big interests were to try and be as efficient and effective as possible. So the things that I was always excited by was when I could find a better way of practicing dentistry. So I'd discover a way of doing something in 30 minutes that used to take me 40 minutes, or that was... that's just the way my brain's wired up, efficiency. And that flowed over into communication. Don't spend half an hour saying it if you can say it in 1 minute, sort of thing. But I can still remember that's not the passion of all dentists. Very early on in my career, I went to an ADA group meeting, and I just discovered some new exciting thing that would cut my treatment times by 6 minutes on such and such a procedure. And I was sort of all beaming, and I was dying to tell everyone, and I told them, and they all looked at me like I just farted or something. It was just like, and then, what do you think of this Shiraz, So I had a great passion for that thing about getting better and becoming more efficient in my practice. And that really held true throughout my career. One of my great friends in dentistry, he mastered his practice, or at least pretty much made it mature in about 1988 or 1990. And then he just kept practicing exactly the same after that. And I thought, how boring to not be looking for improvements. One of the interesting things that came out a number of years ago, it came out of America, but I'd also heard of it through Armour Reed, was the 15-minute crown prep. You can actually get a crown prep and take an impression done in 15 minutes. Now, how do you get there? Well, everybody, when they start out, they take 90 minutes or 2 hours or whatever. So how you get there is by these incremental sort of improvements where you think, if I use this technique instead of that cuts 5 minutes, and then that cuts 5 minutes, and and that's how it goes. So yeah, that was what got me passionate about dentistry, being efficient and effective in how I worked.
I can certainly see dentists falling into, this is the routine of how I do things.
Mm.
And it's that constant and never-ending improvement and breaking down each of those steps of every procedure. Where can I save money, be more economical, be more productive, be more effective? And listening to Howard Ferran's podcast, an American dentist, for those who are unaware of him, he is a classic for saying, one filling, you need 2 burrs and that's it. One crown prep, you need 3 burrs and that's it. Like, just stop with all the fluff, stop with all the extra stuff going on. And I have nursed with dentists that will go through 8 different burrs for the one filling. And of course, I'm old fashioned. I was a dental nurse decades and decades ago. So I'm like, come on, let's go. So I've seen it done in a very efficient way. But to approach your career in that way, that let's not get in the rut of doing things. Let's always be looking at ways of improving, because it's all those little 1% differences that can make an enormous impact in the outcome.
Oh, yeah. I was always testing and measuring. You'd try a new technique and it'd go better than the one before, and you go, beauty, that's part of from now on we're doing that. And then it wouldn't go so well, and you'd go, okay, we tried that, cross that off the list. I think so many dentists are very afraid of making mistakes, and I've often learned the best lessons from making mistakes. Years ago, I flew to a place called Alpine, Utah. So it was a long flight and all this sort of stuff, and it was especially to sit at the feet of this sort of guru dentist and learn from him. And he had this way of presenting treatments to patients that was almost like used car sales. I didn't realise when I was flying over there, just because he had a good reputation, I thought I'd go see him. But it was almost like you were selling used cars. And anyway, I came back to Australia and I thought, well, I spent all that money getting over there. I spent all that time, all that effort. I should at least try it. And so I tried it out on patients, and the patients would walk out of the room after the consultation and the staff would come to me and they'd say, what did you do to Mrs. Jones? She looked green. You know, like, it was absolutely, it was terrible. And I lost, you know, I got to do some dentistry, but I lost so many patients over it. And that was when I had that epiphany about not pressuring patients. I thought, okay, so I've gone to one extreme. I've been to the car sales end of, and then I thought, I wonder how the other end of the extreme is, you know, just no pressure, whatever you want, sort of. And that was what sent me to that other end. And sure enough, that's much more effective. I had another experience. I went over to the Chicago Midwinter, which is a incredible convention if anyone wants to go there, because a lot of the companies release their latest materials and their latest equipment, and also they've got a speaking roster that's absolutely out of sight, like all the big names in dentistry. So it's a fabulous event. I mean, the only drawback, it's in Chicago midwinter and the lake freezes. It's like so cold, it's amazing. But apart from that, it's great. And I went over there and they had a computer system. And this computer system allowed you to play little explainer videos to your patients. So what would happen is you'd be talking, oh, so we need to do a root filling. Here, let me show you what a root filling is, and you play this little video. Anyway, I spent $6,000 on this thing and brought it back to Australia, plugged it in my computer system, and tried it for 1 month. And my acceptance rate went through the floor.
Wow.
Absolutely through the floor. And finally, I realised what happened was people make decisions on emotional reasons. You know, they want something, right? And all that happens, if you give them a whole lot of technical details, you're just activating that part of the brain that's all analytical. You know, A plus B equals C and this and that, and then they get bored and disinterested, and then they find out. So you stick that big pointy thing down inside and all these sort of details that don't really help things at all. And so after 1 month, I unplugged this machine, stuck it away in a cupboard somewhere, and never used it again. So it was $6,000 US, which was, would have been 20 years ago. So it was worth a lot more then.
Yeah.
But great learning experience, like you don't need to give people a truckload of technical details. They need to know the pros, the cons, and then if there are any specific warnings about the treatment. Before we start, there's something you need to know. There's a 10% chance of X, or there's a 5% chance of Y, whatever that warning is. But that's what they need to know, pros, cons, and warnings. Yeah.
And I've often thought to myself, I was a member of Toastmasters for about 12 years. And have you heard of Toastmasters, a public speaking group? And so you present your speeches in front of evaluators, and they evaluate and tell you how to improve. And I've often thought it would be such a powerful process to implement for dentists and dental practitioners, that they can gather physically as a group, develop a nice trust relationship with each other. And this is how I present a treatment plan. This is how I quote. This is how I manage someone asking for a discount, and having other people evaluate. And then we're all on that constant never-ending improvement journey, all learning together. I've often thought that would be very, very powerful, but it does lend itself to having someone like yourself that's done a whole bunch of learning, spent thousands and thousands of dollars on seeing other experts and utilizing their advice, and then taking your own insights out of that. The power of presenting in front of someone like yourself can be a big turning point in your career as a dentist.
Yeah, well, thank you. Yeah, one of the key things I think that dentists do need that they often don't have is they need a system, a systematic approach. If you're doing a class 1 composite posterior restoration, you've got a checklist. Step 1, topical anaesthetic. Step 2, local anaesthetic. Step 3, outline form. Step 4, remove the caries. Step 5, refine the outline. Yeah, so you've got this don't, don't. And I think we should have the same thing in case presentation and communication with patients, because by doing that, it frees you up. Instead of your mind constantly having to reinvent the wheel and think up things as you're going along, you can actually sit there completely relaxed and say, oh, I just did step 3, now I do step 4. And so it goes. Like with airline pilots, I mean, how does hundreds of flights every day all around Australia land safely? The pilots have got a checklist. They're not sitting up there going, oh, what do you want to do now, Fred? Oh, let's put the wheels down. Yeah, that sounds like an idea. No, they've got this sort of, and I think our dental communication can be exactly like that. So what I try and get dentists to do when I speak with them and in the courses is to have this systematic approach to communication, which I find works really, really well. And then once you've got a systematic communication approach, then you run that approach and then you decide, I wonder if I change something a little bit, would it be more effective? So then you change that thing a little bit, and run that for the next month. And you go, that worked better, or no, that was worse, I'm going back, and you can constantly refine and improve what you're doing with patients.
I love that, because it's not the whole approach that needs adjustment sometimes. It's just looking at each specific space that you're holding and recognising that there's little improvements that can be made in all these different areas.
Yeah.
And there are some courses and speakers that I've seen and listened to that, and I'm certainly not one of them. I'm not a big fan of personality profiling and testing of either employees or patients before you start to communicate and interact, because sometimes I think it can you've developed ideas about this person before they've actually revealed themselves to you authentically, and it doesn't allow much space for change and involvement over the years that you know these people. But there is a method out there of determining whether the patient in front of you is a particular personality type, therefore they need this much information, or others are more of a director type that just want to have a very quick amount of information. What are your thoughts around that?
Yeah, I don't think you can analyse people. I don't, people are very complex. And if they were to go to a psychologist whose job it is to analyse people, who's had 5 years of training in analysing people, it's still going to take hours and hours of discussion before that psychologist gets a good handle on what makes that person tick. It's not like even a trained psychologist can look at a person and in 5 minutes sum them up. So I think the amount of time you'd need to invest in dental practice to get a good understanding of somebody would be counterproductive. So I think what you've got to do, you've got to have a way of presenting treatment that's acceptable to all patients. And I'll give you an example. If you're a doctor and you're wearing a white coat and a tie and whatever, and you're dealing with a working class person, you can quite often go as the authority figure. You need to have such and such, right? And quite often working class people will accept that because, they regard the doctor as up here and they're here. And so the doctor can be that authority figure. The problem is if you're dealing with a middle class person or an upper class person or someone who's got a bit of money and you go, you need to have such and such, then they're not so impressed with that. You'll quite often have to send the records down the street. So I think you need to have a way of communicating with people that's acceptable to all people across all classes. And that's why I come back again to that thing I mentioned earlier about offering options to people, not saying you need to or you must. No, I've never found anyone ever who's offended by being given options. Ever. It doesn't matter what strata of society, what they do as a job, what their attitude to things. But there is one little subtlety that I do use. Because I know what I'm going to say next, always when I'm speaking with patients, I'm totally relaxed. So that lets me just watch their body language. And you know how when someone is a little bit bored, you see their eyes, like, okay, right. So if I'm presenting something and I see the eyes bored, I'll press the fast forward button.
Nice.
It's still the same presentation, but I'm just fast forwarding it so to regain their attention, right? Or the other thing is sometimes you see some people a bit skeptical. You know, you read that body language. Well, if I see someone a bit skeptical, I'll press the slow button and just say what I'm saying with a little bit more clarity and emphasis, because obviously it's not quite connecting. But I mean, the basic structure of what I'm saying stays exactly the same, but it's just a variation in speed depending on what you read in their body language.
It sounds like, when we start taking our primary goal of case acceptance being the goal, take that out of it, it relaxes everything. Relax dentist. It relaxes the whole situation for you as a dentist, and you can start to pick up on all of these subtle cues that were blind to you before because you had your eye on a different goal than what is possibly appropriate in the moment, which is just let's deliver the information in as a concise way as possible, because you're right. I wrote something the other day for a client, and I always pass everything I write through Charles first because he's a brilliant human being. And he said, "You've got so much fluff in there that you're not getting to the guts of what you're saying. You've got to say it in a far more concise way." And I remember once reading from a copywriter, whatever you write, take out as many words as possible and still have that message be able to be relayed. And that's good copywriting. The same is true, obviously, with case presentation. Just take out as much stuff as possible.
Well, I say to dentists, if you're saying anything to a patient, you have to think to yourself, why am I saying this? I mean, why are you giving them that information? An example. You could, I don't know if anybody still does VMK crowns or PFMs anymore. Maybe some people still do. They're a good, reliable restoration. So if you're talking with somebody and you decide you're going to tell them what's in a PFM, so you say, and it's porcelain on the outside, so it looks nice and strong, and then inside it has white gold, and that holds it together and makes it really strong. They'll say, white gold. How much gold? And all of a sudden you're talking about all these technical details of treatment that you don't need to get into. So that's why I always say, think about everything you say before you say it. Even a subtle little wording. When I was talking with patients first about implants, I'd say an implant's an artificial tooth that's screwed into your jaw. It looks and feels like a real tooth, right? You hear the word screwed into your jaw, right? What that produces is the patient will then say, that sounds painful, right? And then you've got to spend time explaining why it's not painful, right? And then I changed one word. Instead of screwed, I said placed. An artificial tooth that's placed into your jaw.
Sounds gentle.
all of a sudden, all those questions about pain went away. It's just these little subtleties in what you say. But you've always got to think, why am I saying this? Why am I saying this?
And how could it be said differently to get it to not go down that rabbit warren of other further questions that are unnecessary?
Yeah. Sometimes dentists, they just one of the key steps I say to dentists is before you start talking, you must have absolute clarity in your own mind. Right? Because if you've got 5% confusion here, by the time it comes out of your mouth, it's 50% confusion. Right?
Yeah.
And the moment you confuse a patient, it's, I'll go home and think about it, right? So that's what happens. So I was watching a dentist work with a patient a while ago in Adelaide. And this dentist started explaining to the patient about a root filling and yada, 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 on it went. And then the patient left. And I said, that's interesting. You explained all about a root filling. I didn't think the patient needed a root filling. And she said, oh, yeah, that's right. I just got confused.
Wow. But we tackle these sort of things in a quite unaware way, not recognising the impact that we're having until we focus on it this is part of what I do as my job. This is part of how I help patients achieve a better level of oral health. So let's have a look at how I'm doing it right now. Let me just, contemplate on that. Like you said, contemplate on how all the steps to get a filling done, a crown prep done as well. I really like your analogy of the mechanic. To always think to yourself, how much information do I need about the workings of a car in order for me to give the go-ahead to the mechanic to get it fixed? None. I don't need it. That's why I've gone to this person. And so it's recognizing, isn't it, that certainly less is more when it comes to in helping patients have enough information to be able to make a decision, because they're not making a decision so much about which particular service is going and how that service is actually rolled out. But it's, what do you want? As we were talking about before, what's the outcome you're trying to achieve? You've got two options to do it, a more conservative option or a more permanent option.
Yeah, exactly. One example, I mean, a good example is the root filling. I mean, if you say to a patient, you need a root filling, well, the immediate question is, what's the root filling, right? And typically dentists then pull out a big brochure and they start drawing on a pad and this and cross sections of a tooth. And I mean, I can draw all that stuff, right? But the problem is it just totally confuses and bamboozles the patient. So much easier if a patient says, what's a root filling? You just say, oh, well, your tooth's infected. So what we do is we clean out the infection and seal up the root, and that gets rid of the pain.
Beautiful. Beautiful.
So there it is. That's like 15 words and 10 seconds, right? And they understand, and I've used that for years, and they go, oh, okay, I get it, right? And all this other stuff is just fluff and bubble that they don't need to know. Now, sure enough, before they actually commit or start the root filling, if there's any warnings you need to give them, by the way, before we start, there's one thing you need to know, whatever the warning is, or two things, or whatever. That's fine. But as far as that first instance when they need to understand the treatment, it's just got to be so concise and so compact. The more the better. Example, I mean, if I was explaining a root filling and a crown to a patient, let's say they need a root filling, then a core and a crown. I'd say, okay, so what's going on is the nerve in the tooth died, so we need to clean out the infection and seal up the root. That'll get rid of the pain. Then we've got to make the tooth strong. And we just make something called a crown, which is a cover over the top, holds the tooth together, makes it strong. It's going to take 3 visits and cost you $2,850, but once it's done, you've got a good, strong tooth.
Love it. I love it.
I mean, in what way would that be improved if I took 30 minutes doing it?
Correct. And that saying of a confused mind always says no.
Yes.
And so if you are finding that you're getting a bunch of no's or I'll think about it and they never end up appearing in your appointment book again for that treatment, then there could certainly be improvements made in how you are communicating your messages to your patients. If a dentist was to want to work with you, Mark, to improve their delivery of information to their patients, what would that look like and how can you help them out?
Well, there's 2 different ways. I do have an online course. So you can actually go online and it's it's a lot more content than we've talked about today, but it's all online. TheRelaxedDentist.com. So just go there and click the link and away you go. And there's gets you 6 hours of CPD and you can do it in your own office at your own time and you can replay it over and over. So that's been very popular. Or the other option is I do visit offices. So I'll actually come to offices and present an in-office seminar. And I enjoy travel, and so it works well. Yeah.
Wonderful. And I do encourage practices to do this from the perspective also of all the practitioners have a similar mode of communication with patients. Every now and again, our patients are seeing one practitioner over another because someone's away or there's been an urgency that only the other dentist can see them. And it brings about that consistency, which helps develop the trust that patients have with your practice as a whole. Mm-hmm. But you want to be able to have everybody in that business, in that dental practice, on that consistent and never-ending improvement journey. So we're all improving all the time.
Yeah. Definitely. I mean, I always encourage the staff, the front desk staff and the, clinical staff, everyone to be there because I think it's great that everyone has the same messaging or same way of talking about things. I mean, it's interesting. In most practices I go to, if they ask the front desk person what's a root filling, if they ask the chairside what's a root filling, if they ask the dentist what's a root filling, they get 3 different answers.
And it shouldn't be that way.
No.
And I think getting the whole team be present for either the online course that you've got or be present when you come on site to do training is so crucial, because there are different personality types within dental teams. We've both come across many of them over the years, and there are that small section of people, employees, part of the team that think, I've never seen treatment described to patients the way Mark did. I've never seen it before myself, so I think he's doing it wrong. So to get everybody having that shared knowledge, this is the way we do things here, and this is why we do things this way here, that can only lead to better team unity and that consistent delivery of information to the patient ultimately as well.
Yeah. If you were to compare, I mean, like I said, I've done so many communication courses. The one thing that I think I've really, I'm very glad that I've done, and I think it works well for dentists, is I have made communication systematic. It's step 1, 2, 3, 4, done. Instead of making it something that's sort of random. Yeah. Exactly. That's. I went to a well-known communication course, and they had lots and lots of good stuff. But the problem is there was no framework around it. So I'm thinking, like they give me these tools, a hammer, a chisel, whatever, or, the Ben Franklin close, the alternative choice close, the sharp angled close, all these different sales techniques. And I'm sitting there in front of the patient going, I didn't know which one to use now. And at least with my thing, you're never in doubt. This is, I've just done step 3, now it's step 4. So, yeah.
Amazing. Well, I do encourage dentists who are intrigued by your teachings, Mark, to reach out to you, because everything we do in a dental practice is systematized. The way we answer the phone, the sterilization technique, how we do a filling. So systematize this crucial area of your practice as well. And you will find that you'll naturally become more successful because you're improving, you're gaining a different perspective, you're learning how an expert in the area, through all of their learning and practical experience, has discovered to be a very good way forward. So I encourage everyone to reach out to you. And you've got a contact us page, I imagine, on the website that people can find your email address.
Yes, they can.
Fantastic. Well, thank you, Mark. It's been so interesting and delightful. It's made me think that your kind of teachings are so needed. There are so many communication barriers out there that we just need a bit of direction with that. So thank you for being a guest on the podcast.
Oh, thank you for having me, Julie.
If you enjoyed this podcast, then I encourage you to head over to Amina and my website, dentalbusinessmastery.com.au. You will find all the information that you need if you would like to gain our assistance in helping you and your team achieve great success. We've got online courses, consulting programs, the club membership. We also have a whole bunch of tools and resources that are available for free that will help you achieve your practice goals. If you would like to find out more, you can also email us directly at info@dentalbusinessmastery.com.au. Thanks so much for listening.